The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Today's Health is brought to you by Quaker Oatmeal, DePue Orthopedics, a Johnson & Johnson company, the Institute for the Study of Aging, Pfizer Incorporated, Levo Vuitton, Honda, Dignity Memorial, EndoCare, and CADX Medical Systems.
Prevention is such a better alternative than treatment, but too many of us fail to see the value until it's too late. Hello, I'm Robert Urich, and this is Today's Health. Preventive medicine helps us maintain our health, and fortunately, there are many new ways to help us prevent disease and live healthier.
According to the most recent figures from the American Heart Association, cardiovascular disease is the #1 cause of mortality in the U.S., responsible for approximately 46% of all deaths each year.
These statistics may sound scary, as well they should, but the good news is that many types of heart disease can be prevented with the proper lifestyle choices.
It's common knowledge that physical fitness is an important part of having a healthy heart. But there are plenty of thin, fit people suffering from heart disorders. Why? Because exercise alone does not prevent a buildup of cholesterol in the body. It is equally important, if not more so, to maintain a heart-healthy diet, one that is designed to reduce and remove cholesterol. Studies have shown that lowering cholesterol through diet is an important step in reducing the risk for heart disease. Since 1997, the FDA has allowed leading companies like Quaker Oats to make the substantiated claim that oatmeal, as part of a healthy diet, may reduce the risk for heart disease. This is because Quaker Oatmeal helps to remove cholesterol from the body. According to a scientific review by Dr. David Katz of the Yale University School of Medicine, 3/4 cup uncooked or 1.5 cups of cooked Quaker oatmeal consumed daily can help lower the levels of LDL or bad cholesterol in the blood.
Oatmeal can actually help remove cholesterol from the body. Oat-soluble fiber binds with cholesterol-rich bile acids in the intestine, preventing their absorption. Instead, what happens is that it's removed naturally from the body. In response, cholesterol is pulled from the bloodstream to make new bile acids. As a result, cholesterol levels drop.
Dr. Katz's review also observed that studies indicate that oats can impact other heart disease factors, such as diabetes, obesity, and hypertension. To learn more about the health benefits of oats, log on to www.quakeroatmeal.com and get the latest information on oatmeal and healthy living.
A diet that is rich in fiber and low in saturated fats, combined with a good-sized bowl of oatmeal every day, can help you maintain a healthy heart and live better. And that's news we can all take to heart.
Someone very wise once said that it's not how long you live that counts. It's how well you live during the years you have. If we can take charge of our health and maintain it, we may be able to live better and longer. There are many good ideas to help us stay healthier. Here's one now.
According to the Arthritis Foundation, 22.8 million Americans suffer severe pain caused by osteoarthritis and rheumatoid arthritis. Osteoarthritis and late forms of rheumatoid arthritis affect joints like hips, knees, and shoulders, and may eventually lead to total joint replacement.
The good news is recent advances in technology have made artificial joints better and last longer, helping to alleviate arthritis pain.
One company on the forefront of innovation and technology is DePue Orthopedics, a Johnson & Johnson company headquartered in Warsaw, Indiana. DePue has been one of America's leading innovators and manufacturers of orthopedic devices for more than 100 years, and one that surgeons continually turn to. DePue is the only company to offer mobile bearing knee technology in the United States designed to provide more normal knee function. The company is also leading the way with revolutionary new technologies aimed at improving the hip joint. DePue's focus is to develop innovative products and technologies to increase the longevity of orthopedic implants, building on its history of clinical success. Many suffering from pain are taking a proactive role in coping with arthritis by logging on to www.allaboutarthritis.com, sponsored by DePue, to learn about the latest developments in treatment options in the area of arthritis and joint replacement. Most importantly, allaboutarthritis.com helps locate a physician in your area that uses these advanced technologies. Along with products for hips and knees, DePue is recognized for offering a variety of other implants, including shoulders, ankles, fingers, wrists, and elbows. And now DePue is investing and already has products available in the emerging new field called orthobiologics.
Orthobiologics addresses the future of orthopedics as we move beyond the traditional metal and plastics and toward more biologically based products. DePue currently offers a naturally occurring biologic scaffold implant that helps to reinforce soft tissues in the surgical repair of rotator cuff injuries of the shoulder. Other innovations include bone substitute materials and also ways to use the patient's own blood to help the healing process in surgical cases.
If you or a loved one suffer from arthritis pain, log on to www.allaboutarthritis.com to learn about arthritis and its treatments.
With these new technologies and internet resources, patients can now take control of their arthritis pain instead of the other way around, and that's moving forward.
Imagine the nightmare of being lost and confused in a world where you can't remember any person, any place, or even who you are. This frightening nightmare can be an everyday reality to people who have Alzheimer's disease. It slowly robs individuals of their memories, their personalities, and eventually their lives. The race is on to find answers.
Costing approximately $100 billion per year and projected to cost the United States over $1 trillion during the next 10 years, Alzheimer's disease affects over 4 million Americans, and the numbers are growing.
Unless a cure or prevention for Alzheimer's disease is found, the devastating impact of this illness will continue to grow. That's why finding new treatments for prevention and cure of Alzheimer's is a critical priority.
Alzheimer's disease is caused in part by the buildup of beta amyloid plaques, which form lesions on neurons in the brain, causing them to die. New treatment strategies now focus on inhibiting the enzymes responsible for the production of these plaques. It is still unknown what sets in motion the factors that lead to Alzheimer's disease. This makes much of the research and drug development for this disease risky and expensive. Most scientists working in drug discovery recognize that multiple drugs will be needed for effective treatment, since they believe that Alzheimer's is caused by a variety of factors, including genetic and environmental risk factors. Presently, the only drugs currently available in the United States for treatment of this disease belong to a class of drugs called cholinesterase inhibitors. These treatments may help improve cognitive and daily function, but they do not cure or prevent the disease. There are 4 drugs currently available to treat Alzheimer's disease: Aricept, Cognex, Exelon, and Rimonil. Aricept is the most commonly prescribed drug in this class. Studies show that early and continuous use of cholinesterase inhibitors can have a tremendous positive impact on the quality of life in Alzheimer's patients, which in turn can lead to a significant reduction of stress in the lives of their caregivers.
In order for Alzheimer's patients to receive the maximum benefits from these drugs, it's critical that the disease be diagnosed early, when the first signs of mild cognitive impairment appear, such as losing common items frequently or forgetting the names of long-known acquaintances.
Recently, there's more interest in diagnosing the illness in its earliest possible stage, what people used to consider senility. He's losing his memory, but isn't that appropriate for age 80? Now we know that that may be very mild Alzheimer's disease, should be diagnosed, and if appropriate, should be treated.
Now there is a not-for-profit private foundation that is committed to funding research in the area of drug discovery and development for the treatment of Alzheimer's disease. Responding to the challenge of finding new treatments for Alzheimer's disease, the Institute for the Study of Aging has committed over $16 million for research over the next 3 years, making it the largest family foundation dedicated solely to Alzheimer's disease. Founded by the Estee Lauder family and led by a strong internal scientific team, the Institute currently funds over 50 programs nationally and internationally.
At the Institute for the Study of Aging, our mission is to catalyze and fund drug discovery and drug development for cognitive aging and Alzheimer's disease.
The Institute is supporting research at Helicon Therapeutics in Cold Spring Harbor, New York, where Dr. Timothy Tully is developing exciting new drugs that he hopes will improve memory in normal aging and in Alzheimer's disease.
ISOA's support is allowing Helicon to study the effects of candidate drugs on rodent models of memory so that we can pick one of our compounds to designate as a lead compound and eventually as a clinical candidate to begin clinical studies in humans for the effect of this drug in preventing memory loss during Alzheimer's disease.
In partnership with the Mount Sinai Medical School in New York, Institute funds have helped to create a drug discovery program for Alzheimer's disease. The program is being spearheaded by Dr. Harold Weinstein.
The Institute for the Study of Aging has a very specific aim to develop new therapies and powerful new therapies for Alzheimer's disease. It is the feeling that we are now so close to understanding the etiology of the disease that we might be able to use the newest tools that science offers, especially in the new genomics and in structural biology, to actually go down to the therapies for the disease, not just to understanding its basis.
The Institute is also funding research in universities as far away as Tel Aviv, while also helping companies like Cortex Pharmaceuticals in developing new strategies to treat Alzheimer's disease.
Understanding Alzheimer's disease, learning how to recognize its early symptoms, and knowing what new treatments are available can help caregivers and patients who have the disease.
If you want to find out more or learn how to support the work of the Institute for the Study of Aging, visit www.aging-institute.org and get involved in the search for a cure.
Every day we're faced with new challenges that directly affect our health. Nutrition, the environment, even the weather can influence the way we feel. Now, through the miracle of modern science, we can face these challenges without fear.
With each passing day, it feels like we are working longer. According to the Bureau of Labor, the average American, including part-time workers, puts in at least 5 days a week on the job, not including overtime. Add to this the responsibilities of parenthood, an active lifestyle, or a busy social life, and it's easy to see why so many people feel like their bodies are running on empty.
It's a basic law of physics. To create energy, we need fuel. Cars need it, houses need it, and most importantly, people need it. Even as we sleep, we are always burning energy, and that energy is in constant need of replenishment in order for us to make it through our daily lives. It is important to keep your energy resources at their optimal levels. One safe and effective way to do this is through supplementation of natural compounds found in the body, such as vitamins and amino acids. For generations, millions of people worldwide have enjoyed a refreshing solution to their energy needs by using energy supplements such as Lipovitan, the world's original energy drink developed over 35 years ago in Japan. Lipovitan is an energy drink formulated by Taisho Pharmaceuticals, a respected leader in the over-the-counter pharmaceutical industry. This ensures that Lipovitan is produced under the highest standards in terms of quality of ingredients and effectiveness. This energy drink works by combining a balanced formula of 3 essential B vitamins, B1, B2, and B6, with an amino acid called taurine. The combination of B vitamins and amino acids used in Lipovitan works synergistically with the foods you eat to break down fats and carbohydrates and convert them into energy. When enjoyed chilled on a daily basis, this safe and effective energy drink will exceed your recommended daily allowances of these essential B vitamins and give you the energy you need to successfully make it through today's demanding lifestyle.
Lipovitan is more than an energy drink. It's an essential health supplement. In fact, most stores carry Lipovitan in their vitamin section. To find out more about essential energy supplements and their benefits, log on to www.lipovitan.com and discover your daily energy source.
We may be considered mature adults or fully grown, but inside there's a little kid who still just wants to have fun. Take a look at this next segment and see if it doesn't inspire you to some youthful ideas and joyful opportunities.
Remember the days when you would head out on a journey in just a backpack? The open road called and you answered.
Baby boomers registered over 259 million trips in 1999, more than any other age group. One special trend is motorcycle touring, with baby boomers making up the greater percentage of today's motorcyclists.
In the last 10 years, there's been a resurgence of motorcycle sales in the U.S. Right now, we're in kind of a golden era of motorcycles. Almost everybody's riding motorcycles. Younger people are getting into it. Older people are staying in motorcycles just for the fun, the excitement, the wind in the face, the exhilaration, sharing those experiences with friends. Motorcycling is extremely popular.
The luxury motorcycle touring market was created by the introduction of the Honda Goldwing in 1975. Integrating smooth power with luxury, comfort, and enhanced amenities, the Goldwing became the most successful touring motorcycle of all time.
Balancing the luxury and comfort of a touring bike with the power, performance, and responsive handling of a sport motorcycle can be a design challenge. To meet that challenge, Honda totally redesigned their Goldwing model. The Goldwing was named Motorcycle of the Year in 2001 by Motorcyclist magazine. The 2001 Honda Goldwing blends the comfort, smoothness, and reliability of the traditional luxury touring bike with the power of an 1832cc, 6-cylinder, liquid-cooled engine that delivers close to 120 horsepower on a revolutionary all-aluminum dual-spar frame.
This sportiness makes the Goldwing a great bike for solo riding in addition to two-up touring. With cruise control, computer-controlled rear suspension adjustments, anti-lock brakes, state-of-the-art stereo audio, and expansive luggage capacity, you enjoy the pleasure of touring and the excitement of riding a performance motorcycle. Social as well as mobile, riders also enjoy the camaraderie of fellow touring riders and passengers, in addition to over 85,000 U.S. Goldwing Club members that participate in rally events nationwide throughout the year. To find out more, visit www.honda.com.
Even if you miss your youthful days of adventure, you can still learn how to hit the road and enjoy a true adventure through the fine art of motorcycle touring.
They used to say, hope for the best and plan for the worst. Perhaps there's a middle ground where you can plan for what you want and anticipate the unexpected. Here are some good ideas for taking care of your future.
Just as we grow older, so do the people in our lives. Chances are most of us have dealt with the death of a loved one by the time we reach adulthood. While there is no way to avoid the grief and sorrow of such a loss, there is a way to ease the difficulty of dealing with the details of arranging for funeral or cremation services.
Like anything else in life, having a plan can make all the difference in the world. Pre-arrangement of funerals can be very beneficial, not only for your loved ones, but also for yourself.
Now there is another benefit to a pre-arranged funeral. Dignity Memorial is the first national brand of funeral service, which means you can transfer your funeral plan anywhere in North America within a network of more than 1,400 funeral homes and 400 cemeteries. You can even go online at www.dignitymemorial.com and check on services available in your area. The Dignity Memorial Network also adheres to certain standards of service and consistency.
We send questionnaires through an outside firm to every family we serve to make sure they were satisfied with their experience. They're asked to comment on things like how courteously they were greeted on the telephone, the condition of the funeral facility, professionalism of the staff, whether pricing and merchandise were clearly presented, and much more. Nearly half of them respond, and almost 99% say they would be willing to recommend Dignity Memorial to others, We're very proud of that. In fact, we take customer satisfaction so seriously that we offer a 100% service guarantee.
The people that benefit the most from prearranging funerals are the survivors. If you never have the conversation telling your loved ones your wishes, they are left with the added burden of having to guess what you want and hope that they are respecting your wishes.
Do you want burial or cremation? Do you want the service to be held in the funeral home or your place of worship? What kind of permanent memorial do you prefer? By making your personal choices in advance, you're able to avoid a lot of confusion about the ceremony, the content, even the cost. Prearranging is one of the greatest gifts you can give to those you leave behind.
Even though it may be a difficult subject, we all have to face the fact that our day will come. For our loved ones' sakes, it seems like a good idea to look at all of our options and handle the ultimate last detail.
The key to treating prostate cancer lies in understanding it. Although the exact cause is still unknown, researchers and doctors have come to a better understanding of how it develops and progresses. As our next story shows, early detection and knowing all your treatment options can yield significant benefits to both the doctor and the patient.
According to the American Cancer Society, this year there will be close to 189,000 new cases of prostate cancer diagnosed, and more than 30,000 men will die of the disease. However, men diagnosed with prostate cancer have a survival rate of more than 95% after 5 years if the disease is treated. This is a result of several factors, including better treatments and increased public awareness that has led more men to have regular exams, such as the PSA blood test. In the past, the three most common forms of treatment for prostate cancer have been to remove the prostate through major surgery, to treat the cancer with external radiation, or to implant radiation seeds called brachytherapy. But surgery is painful, requires a long recovery, and in many cases causes the loss of sexual function and urinary control. External radiation and brachytherapy take months, cause collateral damage to surrounding tissue, and often result in side effects such as incontinence. Now there is an alternative FDA-approved treatment for prostate cancer that offers a quicker recovery and significantly reduced side effects when compared to major surgery and radiation. This procedure uses targeted freezing of the cancer cells and is called cryocare.
As opposed to other treatments, cryotherapy actually works well in all spectrums of the disease. Cryotherapy is a minimally invasive procedure that involves inserting 6 to 8 slender probes into the prostate. The probes are filled with argon gas, which freezes the tissue we've carefully targeted. We use a warming catheter to protect the urethra from harm, and ultrasound allows the physician to place the probes in the best possible position to kill the cancer without harming surrounding tissue. Temperature sensors carefully monitor the process and precisely determine when targeted temperatures have been reached.
If need be, the cryocare procedure can also be repeated, unlike major surgery or radiation. The benefits of cryocare include fewer side effects, such as a loss of sexual function or urinary control.
We can treat the patient in 2 hours, their cancer is destroyed, they can leave the hospital the same day and get back to an active lifestyle in 1 to 2 weeks.
I felt too good for my own good. I was driving, I was shopping with Ann, I was going to church.
In addition to being FDA approved, cryocare is reimbursed by Medicare and many other insurance plans. To learn more about effective prostate cancer treatments, log on to www.cryocarepca.org. With cryocare, you just may be able to stop cancer cold.
Staying healthy is important to all of us, and new discoveries in the fields of science and medicine are giving us more options when it comes to our health. In our next story, we'll look at a new solution to an old problem.
In the fight against breast cancer, there's little question that early detection is the key to survival. In the ongoing battle to detect breast cancer at its earliest stages, the medical industry is employing the use of new and innovative tools, including advanced computer technology.
In recent years, the widespread use of regular mammography screenings has been a major contributor to the improvements of breast cancer survival rates. And while mammography has proved to be a powerful tool in the fight against breast cancer, accurate readings of mammograms can sometimes be difficult.
A mammogram, although it's the best exam we have, as you know, is imperfect. The reason is that the density of breast cancer is very similar to the density of dense breast tissue. It's very much like trying to find a specific cloud in a cloud-filled sky. It's very difficult.
Even the most trained eye can miss subtle variations in tissue that may be of concern. The result is that 20 to 30% of cancers can go undetected during the screening process. That's where recently developed technologies such as computer-aided detection, or CAD, can help. Second Look, a new CAD system from CADX Medical Systems, is a sophisticated tool that assists radiologists by providing a computerized second review of mammograms, which helps to identify potentially cancerous lesions.
The technology utilized in Second Look is derived from the same technology utilized by the U.S. military in their Smart Weapons program.
By highlighting potential areas of concern for the radiologist, Second Look calls their attention to subtle changes in tissue that may indicate the presence of cancer. Studies have shown that a secondary review of mammograms performed by an additional radiologist can increase the sensitivity of breast cancer screening by as much as 15%. CAD technology has the potential to do the same. So how does it work? The system digitizes mammograms, then creates a laser-printed report that the radiologist uses as an alternative perspective when making a final diagnosis.
So what computer-aided detection does is it objectively analyzes the mammogram and points out specific areas of interest. The radiologist then goes back and reviews those areas to decide if they're significant or not.
New technologies can now help you get a more accurate reading of your mammograms, providing a powerful tool in the early intervention of breast cancer.
Armed with the right attitude and proper knowledge, we can face almost any challenge with courage and success. And today we've gathered new insights on several important health issues that can impact our everyday lives. If you have any questions on any of the topics we've discussed on today's show, log on to vstar.com and we'll link you right to the source. I'm Robert Urich, inviting you to join us next time as we explore the issues that affect your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.